Good morning. Thank you so much for talking with us.
You bet. Well, let's talk about some good oral health. And why is good oral health so important to our overall health?
Well, thank you for asking that question. 90% of medical issues have an oral manifestation, and there are very strong linkages between oral health and diabetes, heart disease, and even Alzheimer's. Also, a pre-existing oral issue can postpone or cancel major medical procedures such as heart surgery, chemotherapy, transplants, or joint replacements. And unfortunately, it's an accident of history about how physicians are trained and dentists are trained that silos oral health from overall health, which keeps it out of far too many public health and policy conversations. We need to change this. It's time to put the mouth back in the body.
How serious is the oral health problem in our country?
Well, we think it's a public health crisis. An estimated 74 million Americans have no access to oral health care, which is nearly twice the number of people without health insurance. And in fact, 1 in 3 Americans don't have dental insurance. And when we talk to people, 3 out of 4 people, 75% of us, say that we've experienced one or more barriers to accessing oral health care, the largest barrier being cost. And there are serious health equity issues as rural Americans, Black and Native Americans all experience significantly lower access rates to oral health care. So this is a problem that we can't ignore.
How concerned are people about the state of oral health in this country?
Well, you know what? We are very concerned about it. We, when we talk to folks across the country, more than half of the patients actually rated their oral health as their top personal concern. They're more concerned about their oral health than they are about their heart health, their eyes, their skin, digestive, or even mental health. They also say that the oral health care system is expensive. They think sometimes it's scary, it's inconvenient, and it's confusing. And in fact, 6 in 10 Americans rate the system as fair or poor. So patients do see that we need to fix this broken system.
So, Allison, what can be done to fix this care gap?
Well, there are 3 things that we're really focusing on today. The first is prevention. We need to get more people connected to preventive oral health, including regular screenings, cleanings, basic education. Oral disease is almost 100% preventable, and prevention obviously is critical to improving overall health and oral health. Another critical area is improving the collaboration between the medical field and the dental field. If we can bring together all types of providers, doctors, dentists, nurses, hygienists, to focus on a patient's overall health, not just the specialty, everybody will be healthiher. For kids in particular, when they go in for their annual physical visit, if the physician looks in the mouth and not only checks out what's going on with their tonsils, but also takes a look at their teeth, it's a great way to identify problems with their teeth and a great opportunity to refer the child to a dentist. And then the third way that we can improve oral health is by improving access to care. We can bring more oral health services into non-traditional settings like schools and community health centers. More dentist offices opened on the weekends or before or after work is one important piece. And the second piece is really about bringing greater access to oral health benefits. Right now, Medicare does not cover oral health, although just yesterday the House of Representatives passed a bill that does move to include oral health as part of Medicare. And we know that this is something that over 80% of Americans feel should be covered by Medicare and is an opportunity for us to really start to solve this crisis by providing access to oral health benefits.
Excellent. Yeah, get some conversation going. So in closing, Allison, what progress is being made in addressing the care gap? Medicare is a great one. Are there other areas that are, addressing the issue?
Absolutely. At DentaQuest, we're working hard to transform this broken oral health system from the inside out. It's not easy, but we do think we're making progress. We see much greater awareness of oral health across the country, and having interviews like this is an important step forward for that. We do see more dentists and other health providers working with physicians to care for the whole person in new and different ways, and we are seeing much more positive momentum on things like adding coverage to Medicare. So there is progress on many important fronts, and if people are interested in learning more about this, they can visit us at DentaQuest.com.
Excellent. Thank you so much for spotlighting this. This is a real eye-opener, and we appreciate you sharing this information with us.
Well, thank you so much for taking the time to speak with us.